Following prostate cancer treatment, regardless of the treatment received, it's important that patients advocate for correcting those quality of life issues that were affected. This could be the erections and a weakening of erections that may occur right after the treatment or may subsequently develop down the road. But patients need to know that there's treatments out there that we can work with to improve those. The other thing when it comes to erections following different prostate cancer treatments is that we have much better long-term success by addressing that aspect early rather than waiting. Sometimes by waiting, the structural change of the penis will occur, and that structural change may impact what we're able to utilize down the road to help with those erections. The same holds true for some of the incontinence aspects. We can work to maximize the recovery there, trying to speed recovery and help patients out. When it comes to radiation type treatments, there are ways to minimize the effects of the irritation within the bladder wall, trying to get patients to be able to sleep better throughout the night, not have to void quite as frequently. So I think the big thing for patients in their recovery following any prostate cancer treatment is to advocate for themselves and push to find specialists that are willing to look at these aspects, these quality of life aspects, and offer treatments. You may not have to accept all of them, you may not want to do some of them, but at least know what options are out there. There are several benefits to seeing a men's health specialist. One is that that's what the person's focused on. When patients come to my office, I understand and know how to treat a lot of the different urologic diseases, but my focus, my experience, the experience of my staff all comes from doing this repeatedly, hearing patients' questions, hearing their concerns, finding out answers and ways to help them get the information they need. The other thing is that sometimes when you see a men's health specialist, the questions that come up may be a little bit more direct. You may be asked, instead of just, are you getting erections, how firm are your erections? Is it rigid enough for sex? Does it last long enough? And those are important aspects to the recovery. It's not just, did the erection start to show up? Is it usable for sexual activity? And not just any sexual activity, is it usable for what you perceive as the important aspects of sexual activity and intimacy? So seeing a men's health specialist can really help you focus in and get the care you need, particularly with recovery in regards to prostate cancer surgery. Prostate cancer very much impacts sexual function. We know that even before treatment for prostate cancer, many men are dealing with trouble with erections, and that things as simple as repeated biopsies may actually cause trouble or worsening of erections. Prostate cancer treatments, depending on which one you choose, may have an immediate impact on erections or may have a delayed impact on erections. But I think it's important to note that no matter what treatment for prostate cancer is chosen, almost all of them will have an impact on erections. And it should be expected as such because the nerves that actually kickstart the process for an erection run smack dab up against the prostate. So if you're going to treat the entire prostate in any sort of fashion, those nerves have the risk of getting injured and needing time to recover, if they'll ever recover. Additionally, some of the things like radiation can impact the blood flow that comes into the penis that should allow for erections to occur. So there's a profound impact there. The key for us is that we can treat it and we can actually get patients back to recovery of sexual function at the same time as getting them back to intimacy, so that we're not sacrificing their overall recovery, but also allowing them to get back to a much more normal life early in the course following prostate cancer treatment, rather than having to wait a particular set amount of time. Prostate cancer and prostate cancer treatments very much can affect how our bladders function. Depending on what the treatment was, whether it's surgical removal of the prostate, some other attempt at surgery of the prostate, or radiation type therapies, they all have an effect on how our bladders function and what we expect to see as far as functioning and quality of life changes that occur following it. When it comes to surgical removal of the prostate or surgeries on the prostate, we tend to see more incontinence afterwards, leaking of urine, particularly with cough, sneeze, laugh. It's because the muscle that's present there now does not have the support of the prostate to help limit that leakage. It's important that we work to build that muscle back up and promote recovery to help patients regain being dry or as dry as possible in those scenarios. Radiation, however, as well as some of the other alternative types of treatments for prostate cancer very much impact the bladder too. Those radiation type approaches can also weaken the muscle, the external sphincter muscle that's present, which may cause problems down the road where patients experience more of that cough, sneeze, laugh type of incontinence or leakage. Additionally, radiation can cause some irritation of the bladder. The irritation of the bladder may come out in the form of blood in the urine, or it may just be something where patients experience the urge to go more frequently. They go more frequently and they notice that the volume of fluid that's coming out is not as high as it had been in the past. These are all things that are quality of life impacts on patients, and all things that we can work to improve. It's not something that patients have to live with following any sort of prostate cancer treatment. Following the treatment of prostate cancer, patients will often follow very similar courses. It doesn't mean that every patient's going to have the exact process as all the other patients. But following surgical removal of the prostate, most patients will have some leakage of urine initially, much worsening of erections initially, with recovery over the first 1 to 2 years. Following radiation type treatments or HIFU type treatments, patients may not have the impact immediately, but they may notice more irritative symptoms, meaning they need to urinate more frequently or rush to the bathroom. However, when we look down the road at about 2 years out, those patients are also going to be having trouble with erections, and the two curves are very similar when we look farther down the road. The recovery process is also very much dependent on what are the other medical problems that patients have. Did they have erectile dysfunction before their treatment, which makes it less likely they'll get full recovery following treatment. Age of the patient makes a difference in how well they recover, as well as what kind of function and quality of life impacts they have down the road. For patients that weren't very mobile or active previously, the incontinence may not be a big deal down the road, whereas patients that are very active, work in a highly physical job, that incontinence may have a much more profound impact. I think the key here is that patients recognize there are things we can do, no matter what the side effect is treatment-wise from the prostate cancer. We almost always have something we can do to try to improve upon that quality of life measure for patients. In my mind, the biggest thing that patients and their partners can do to expedite and facilitate recovery following prostate cancer treatments is to advocate for themselves, to learn what options are out there, and to pursue getting the answers that they need. If the physician that provided the prostate cancer treatment is not comfortable or doesn't have the answers that patients are looking for, there are others out there, and that's where a men's health specialist can really come into play and offer patients the guidance they need. It's not that anything went wrong with the prostate cancer treatment. In fact, we should expect a lot of these quality of life changes after the treatment, even in the best of hands. It's a process that occurred because of the anatomy, because of the underlying condition, and therefore we don't want that cancer to continue to have an impact on patients. We want to be able to not just treat the cancer itself, but let's treat the side effects of that treatment so that we can make sure patients get back to as normal as possible. For some men following prostate cancer treatment, we'll actually see their natural erectile function improve and recover. It's going to be very much dependent on what other medical problems they have, what medications they take, what kind of erectile function did they have before the treatment for prostate cancer. The other thing we have to do is provide time for this recovery to occur. And during that time of recovery, we want to make sure there aren't physical changes within the penis that are going to change or hinder the ultimate recovery. When we look at different treatment options, there's a number of options out there. As far as long-term cure, our goal is to get patients back to the most simple, effective erections that they possibly can have. For many men, that may be that they just use a medication, oral medication on a daily basis. And if that works for them, that's fantastic. Hopefully we even get men back to where they're having natural erections and they don't need any medication. For some men, though, it does mean that we ultimately look at a penile prosthetic, a device where patients know it's going to work each and every time, where they don't have to worry about having medications with them or planning ahead of time, allowing for a little more spontaneity. So this is something we tailor for each individual, and we don't need to rush into surgical options, but it's important that we do something to help patients improve their long-term outcome. And as we look down the road, to recognize that we have options so that sexual activity is not something that has to go by the wayside just because of treatment for prostate cancer. The good news is, following prostate cancer treatments, many men will actually regain their bladder function and their continence. Many men just need a little bit of time and potentially some supportive measures or extra training on what muscles to be constricting to regain that continence. However, for men that don't regain that continence, or that subsequently have radiation type therapy, or maybe they had radiation first and subsequently have their prostate removed, where the muscle that's present gets injured, there are treatments we have down the road to improve continence in those settings as well. In that setting, most of our continence procedures are going to be somewhat surgical in nature. However, success rates are very high, and it is a patient population where they really notice a huge quality of life difference upon treating that continence or incontinence as it may be. Many men worry about penile length and girth changes following prostate cancer treatment. Simply put, the best way for us to minimize these changes is to start treatment early on. In fact, at times it's been encouraged that patients even start treatment for improving the erections prior to undergoing their prostate cancer treatment. We don't have great evidence that that makes a huge difference, but logically what we want to do is bring in as much high-quality blood flow that's highly oxygenated to help maintain the structure of the penis. A vacuum device, or what's called a vacuum erection device, has been shown to help minimize any changes in penile length in the first year following radical prostatectomy. Additionally, I think what we want to do is get patients back to sexual activity. Most patients, as they get back to sexual activity, will realize that even if there is a subsequent change from where it was when they were younger, that it's not a huge impact, that it's actually something that doesn't create nearly as much bother as they had worried about in their head, and most often the partners are not bothered by it as well. There are measures to try to maximize length and girth when we look at a penile implant. However, I think it's important that that's a detailed discussion with your sexual medicine specialist to ensure that the ultimate outcome meets what the patient's expectations are. In general, we don't need to overthink men's health, whether that's men's sexual health, men's fertility health, or just health in general. We know that exercise is a key component to keeping men healthy, whether that's specific weight loss or just getting the exercise to maintaining good blood flow. Both are important. For some men, it's trying to improve our diets, finding less processed foods, eating foods that we know are healthier in regards to fruits and vegetables, trying to minimize excess fat, eating higher quality proteins. Those are going to be all important. Even with all that, sometimes there are genetic factors that we're not going to overcome, whether that's cholesterol or something else, such as blood pressure. Medications and staying on the medications prescribed by your physician are very important as well. Even if your medication starts to cause trouble with erections, go talk to your doctor, talk to a sexual medicine expert, find somebody to work around that so we're taking care of both problems, not just sacrificing one for the other. I think when we really break it down though, men can make a huge difference for themselves if they look after their overall health, if they're trying to make a difference. It's not going to all come at once. Trying to stop smoking, weaning back on that, trying to make sure alcohol's in moderation, minimizing drug exposure. Those are all things that are going to have a long-term impact in making sure men have as healthy of an erection as possible, as well as just an overall quality of life.